Welcome to the deep dive. Today, we're really honing in on a specific question we know is relevant for at least one listener. You're currently managing your MS with Ocrevus, and now Kesimpta is on the table as a potential switch.
Yeah, and that's a big deal. It's a really personal decision, it's a significant one. So our aim here is basically to explore what the sources are saying, try and bring some clarity.
Exactly. We want to help you think it through.
And to do that, we've gathered a few different types of information. We've got some medical news articles, explaining Kesimpta,
Okay.
a direct comparison piece, looking at both drugs side by side, and also, maybe the most relatable stuff, experiences from people in an online MS community. Real people who face this choice.
Right, the real world perspective. So our mission for this deep dive is pretty clear. Let's unpack the key things you'd want to consider when thinking about switching from Ocrevus to Kesimpta.
We're talking about how well they work, efficacy,
Uh-huh.
the practical side, like how you actually take them,
Administration, yeah.
with potential side effects, obviously.
Mhm.
Cost is always a factor.
Always.
And like you said, what other people's experiences have actually been like making that switch.
The goal is that by the end of this, you feel, well, more informed and maybe better prepared for that crucial chat with your neurologist.
Sounds good.
Okay, let's jump right in then. The big question first. How effective are these treatments? How do they stack up in managing MS?
Okay, so fundamentally, both Kesimpta and Ocrevus are from the same family of drugs. They're what we call CD20 monoclonal antibodies.
Right.
Which sounds technical, but basically, think of them as targeted missiles for certain immune cells, these B cells that play a big role in the inflammation and nerve damage in MS.
So they're going after the same target, essentially.
Pretty much, yeah. Their core job, attacking those B cells, is very similar,
Yeah.
even if the specific molecules are slightly different.
So if the mechanism is similar, what about the results, the clinical trials?
Well, looking at the trial data, they actually come out looking quite close. Our comparison source mentioned Kesimpta showed around a 50% reduction in yearly relapses compared to a placebo in relapsing MS. 50%, okay.
And Ocrevus, in its trials against interferon beta-1a, showed about a 47% reduction.
So 47 versus 50. In terms of stopping relapses, that sounds, well, pretty comparable on paper.
It does, based purely on those headline numbers from the trials. But when you dig into some of the other sources, like the online discussions,
Ah, the real world stuff.
yeah, you get some nuances. One source, looking at online sentiment, mentioned a sort of feeling that Ocrevus might be seen as, quote, slightly more powerful.
Interesting, but
But that same source noted there was also more negative talk about Ocrevus side effects online. So it's a bit of a mixed bag in terms of perception, and, online sentiment isn't hard data, but it does reflect lived experience.
absolutely, you can't ignore that.
Yeah.
And speaking of lived experience, especially for someone already on Ocrevus, this term kept coming up in the sources, crap gap.
Ah, yes, the crap gap.
It seems quite common for some Ocrevus users. Can you explain what that actually is and how Kesimpta might be different there? Sure. So the crap gap is basically the term people use to describe a period, often like the last few weeks or maybe even month before their next 6-monthly Ocrevus infusion,
Okay.
where they feel their MS symptoms start creeping back or getting worse. It's not that Ocrevus has totally stopped working, but maybe the drug level in their system is dipping low enough for symptoms to surface more noticeably.
Right, just before the top-up, so to speak.
Exactly.
Yeah.
Now, Kesimpta, because it's given much more often, it's a monthly injection after the loading dose.
Hopefully, okay.
It tends to keep a more steady, consistent level of the medication in your body. So theoretically, and what many users report, is that this avoids or really minimizes that dip. Less chance for that crap gap.
Did the sources mention people specifically finding that benefit after switching?
Yes, definitely. We saw comments on Reddit from people who switched saying exactly that. One person mentioned their gap went from being quite long, like almost a month on Ocrevus, down to just maybe a few days on Kesimpta. That consistent feeling could make a huge difference to quality of life.
I can imagine. That sounds like a really tangible benefit. And there was another point about timing, wasn't there? How fast they work.
Yeah, the comparison piece suggested Kesimpta might reach its sort of full effectiveness a bit quicker, maybe in about 6 months, whereas Ocrevus might take closer to a year.
Okay. So for someone switching, maybe Kesimpta gets up to speed faster.
Potentially, yeah. That could be another factor to weigh. So efficacy seems broadly similar based on trials, but Kesimpta might offer that more consistent month-to-month experience without the crap gap and maybe a faster ramp-up.
Got it. Okay, let's move on to how you actually take these drugs. Administration. This is where they seem really different.
Oh, absolutely. This is a huge practical difference. Ocrevus, as you know if you're on it, is an IV infusion.
In a clinic or hospital.
Right. After the first couple of doses, it's one infusion every 6 months. The sources said the first one can take maybe 3.5 hours, later ones closer to 2 hours. Plus travel time, scheduling.
It's a whole day event, potentially.
It can be, yeah. Though, interestingly, someone on Reddit jokingly called them infusion naps, so people adapt.
Ha! Finding the silver lining.
We should also mention there's a faster subcutaneous Ocrevus injection in development, like 10 minutes. It's got FDA acceptance based on EU findings, but
But it's not available yet in the U.S.
not yet. So
Yeah.
for this decision, right now it's the IV Ocrevus we're comparing.
Okay, so IV Ocrevus versus Kesimpta, which is...
Kesimpta is completely different here. It's a subcutaneous injection, meaning just under the skin that you do yourself at home.
At home, once a month?
Once a month, yeah, after an initial loading phase.
Mm.
The first month is a bit different. Weekly shots for 3 weeks, skip a week, then on to monthly. But the injection itself takes minutes.
Wow. So the convenience factor seems massive. No travel, no infusion center.
For many people, yes.
Mm.
That time saved, the flexibility, maybe avoiding medical settings, if that causes anxiety.
Right.
It's a big draw.
We definitely saw that reflected in the Reddit comments, didn't we? People really highlighting that convenience.
We did. Although some people actually prefer the Ocrevus schedule. Thinking about treatment only twice a year has its appeal too.
True. Set it and forget it, almost.
Kind of. So it
Yeah.
really boils down to personal preference and lifestyle. Does a couple of longer clinic days a year work better? Or does a quick monthly task at home fit better?
What about the injection itself? Needles can be a worry for people.
Good point.
Yeah.
The Kesimpta comes in an auto-injector pen, designed so you don't actually see the needle. Lots of users described it as really quick, relatively painless. Some mentioned getting practice pens first too, which can help ease any anxiety.
That's helpful. One person who was nervous said it was much easier than they expected.
Exactly.
Okay, so administration. A clear choice between less frequent, longer clinic infusions for Ocrevus and more frequent, very quick at-home injections for Kesimpta. Let's tackle the next big one, side effects. What did the sources say?
Okay, starting with Kesimpta. Common things mentioned were injection site reactions. So maybe some redness, itching, or discomfort where you inject.
Makes sense.
Also, upper respiratory tract infections, colds, basically, and headaches were listed as common, and because it affects the immune system.
Risk of more serious infections.
Right, that's a potential serious side effect for both these types of drugs. One thing noted for Kesimpta is that some people get more flu-like symptoms, especially after the very first dose, but that usually lessens with later doses.
Okay. And how does that compare to Ocrevus side effects?
With Ocrevus, the big one people talk about is infusion reactions, particularly with the first couple of infusions. Things like itching, rash, maybe fever, chills.
That's why they give the pre-meds, right?
Exactly. They usually give things like antihistamines and corticosteroids beforehand to try and prevent or reduce those reactions. Other common side effects listed were respiratory infections similar to Kesimpta and also skin infections.
Any more serious concerns mentioned for Ocrevus?
Well, like Kesimpta, the risk of serious infections due to immunosuppression is there. Some sources also mentioned a potential increased risk for certain cancers as a possible serious side effect with Ocrevus, which wasn't highlighted in the same way for Kesimpta in the sources we saw, but both suppress the immune system.
Okay. And some people feel rough after the Ocrevus infusion itself.
Yeah, some users report feeling pretty significant fatigue, maybe some flu-like symptoms for a few days afterwards.
So it sounds like both have that underlying infection risk because of how they work on B cells, but the immediate side effects are different. Injection site stuff for Kesimpta, infusion reactions for Ocrevus.
That's a good summary. And the Reddit experience has really brought this home. We saw people who had bad reactions to Ocrevus, even allergic ones after multiple doses,
Wow.
who then switched to Kesimpta and tolerated it much better. But, it could easily go the other way for someone else. It's very individual.
Very individual. That's key. Okay, let's shift to something practical and often decisive, cost and access. What did we find out there?
This is tricky because list prices often don't reflect the real cost. But according to that comparison source, in the U.S., Kesimpta's annual list price was higher, around $88,000 per year.
88,000. Wow. And Ocrevus.
Ocrevus was listed around $65,000 for the first year, Then about $32,500 for the following years, because the dosing changes slightly after year one.
Okay, so on paper, Kesimpta looks more expensive annually in the U.S.
On paper, yes. But, and this is a huge but, what someone actually pays depends massively on their insurance. Copays, deductibles, coverage tiers. It can vary wildly. And location matters too. Costs and coverage are different in the UK, Australia, etc.
Right, so that list price is just a starting point. You absolutely have to check your specific insurance.
Absolutely critical. And don't forget patient assistance programs. Both manufacturers often have programs that can significantly lower out-of-pocket costs for eligible people.
What?
One Reddit user who was a nurse dealing with insurance really emphasized looking into those.
Good tip. What about just getting the medication?
Seems like it can vary. For Kesimpta in the U.S., it often comes through specialty pharmacies. Some people found that smooth. Others mentioned needing phone calls or online forms for refills.
Okay.
Ocrevus, being clinic-based, is different. It's about scheduling the infusion appointment. We saw comments from people outside the U.S., like Germany or Ireland, saying they got Kesimpta from a regular pharmacy, so again, it depends where you are.
So cost and access very dependent on individual insurance, location, and checking assistance programs. Okay, let's broaden out again. Thinking about daily life, personal preferences. We've touched on convenience and the crap gap. Anything else?
Well, the time commitment difference is real. Those Ocrevus infusion days can eat up time travel. The infusion itself may be feeling wiped out after, twice a year, but significant days.
Versus Kesimpta's quick monthly injection, but you have to remember it.
Exactly. If you're someone who struggles with remembering regular medication, that's a consideration. Though apparently there are reminder apps available in some places. For Ocrevus, the planning is different, focused on those two big appointments.
And what about practical things like travel?
That came up. Kesimpta seems pretty travel-friendly. It can apparently be kept at room temperature for up to 7 days.
Oh, that's handy.
Yeah, and there are travel cooling packs if you need longer. Definitely more straightforward than trying to schedule travel around a fixed 6-month infusion appointment.
Good point. Anything else? Vaccinations?
Ah, yes, vaccinations. Since both drugs dampen the immune response by hitting B cells, timing vaccines can be complex. You want to get them when your body can still mount a decent response.
Tricky with ongoing treatment.
It can be. An Ocrevus user on Reddit talked about juggling vaccine schedules around infusions, even delaying an infusion on doctor's advice for better vaccine effectiveness. Another user wondered if the constant suppression from monthly Kesimpta might make finding that optimal vaccine window harder.
Definitely something to discuss with the neurologist.
Absolutely. Personalized advice is key for vaccine timing with either drug.
Okay, these are all really important quality of life considerations. Now, let's zoom in on those Reddit stories again, specifically from people who made the switch from Ocrevus to Kesimpta. What were the main takeaways?
A lot of the switches seem driven by wanting to ditch the crap gap.
Understandable.
And also the sheer convenience of not going to the infusion center. The home injection was a major plus for many.
Did they feel it worked as well?
Many reported feeling the efficacy was similar, that Kesimpta managed their MS just as well as Ocrevus had. For them, the main difference was how they took it and feeling more consistent, without that pre-infusion symptom return. But we also saw people saying both drugs worked well for them overall in controlling the MS itself.
Any sort of emotional aspects that came through in those stories?
Yes, definitely. One person specifically chose Kesimpta because medical settings triggered anxiety from past relapse trauma. Being able to treat themselves privately at home was huge for their mental well-being.
I can see how that would be incredibly important.
Another person mentioned feeling more empowered doing the injections at home with family support, rather than feeling like a patient in a hospital setting. It really shows that how you receive treatment impacts more than just your physical health.
Absolutely. It's the whole picture. Okay, so this has been really insightful. As we wrap up this deep dive, let's try to summarize the key differences for our listener who's considering this switch.
Okay, so both Kesimpta and Ocrevus seem highly effective based on trial data for relapsing MS. They work similarly, targeting B cells.
Right. Similar efficacy.
The big differences are in administration. Ocrevus is the twice-yearly, longer IV infusion in a clinic. Kesimpta is the monthly, quick, self-administered injection at home.
And that leads to differences in convenience, time commitment.
And the types of immediate side effects infusion reactions with Ocrevus versus injection site reactions with Kesimpta, though both carry that general risk of infections.
And crucially, that crap gap some people feel before Ocrevus infusions seems much less likely with Kesimpta's monthly dosing.
Exactly. Cost is another differentiator, with Kesimpta having a higher list price in the U.S., but actual cost depends heavily on insurance and assistance programs.
So when it comes down to it, there isn't one that's just clearly better.
Doesn't seem like it, no. It's not that clear-cut. The best choice really seems to depend on the individual. What fits your lifestyle? What do you prioritize? Convenience, frequency, avoiding specific side effects. How much does that potential crap gap bother you?
It's about weighing those personal factors.
Absolute.
And that's why, while hopefully this discussion has laid out the landscape, the absolutely essential next step is talking this all through with your neurologist.
Cannot stress that enough. They know your MS history, your specific situation, and they can give you the personalized guidance you need to weigh these pros and cons for you.
Right. This
Yeah.
is general info. That conversation is specific to you. Okay, so as you mull this over, maybe here's a final thought to leave you with. Thinking about your current treatment with Ocrevus, what single aspect, maybe the frequency, the location, how you feel between doses, the mental load, what one thing has the biggest impact, positive or negative, on your daily life and overall well-being right now?
That's a good question.
Focusing on that might just be the clearest lens through which to view this potential switch to Kesimpta. Thanks for diving deep with us today.